A very good afternoon to one and all. At the outset, let me thank the organizers, both ESI and the Endocrine Society of Maharashtra, for inviting me to speak on the topic planning meaningful research in daily practice, something that's dear to my heart, and this will be the outline of my talk. So, to research or not, that's the question. And I think I should begin by mentioning what research is not. So, research is not mere gathering of information or data, neither is it a catchword for attention. But good research involves an ongoing effort that helps in developing or improving services and essentially requires teamwork. And my favorite definition of a researcher was given by Einstein, who actually said that researchers are passionately curious professionals who bring about change. Besides, it also sets up a virtuous cycle in which knowledge can be advanced and definitely requires to be nurtured. So, one of the principal elements in research is asking questions. I think I may have, and many of us would have happily munched on that apple had it fallen on our heads, but not Isaac Newton. He actually asked, why did the apple have to fall down? And this kind of inquisitiveness actually led to the concept of gravity in all its complexity. And I also think Rudyard Kipling is right when he said, I keep 6 honest men who taught me all I knew. Their names were what and why, and when and how, and where and who. Now, let me tell you the story of 3 silversmiths who came to us with bony pains and muscle weakness and insufficiency fractures. Now, all of them had features of a hypophosphatemic osteomalacia, which actually got us thinking, why osteomalacia and how come all of them were silversmiths? So, when we got talking to them, they actually mentioned that their job, besides working with silver, also involved other heavy metals such as cadmium. So we went about doing a heavy metal screen on them, and strangely, all of them had toxic levels of cadmium, which actually caused renal tubular acidosis and the consequent osteomalacia. Now, this was something that we thought was worth reporting given its sheer rarity. Now, you can see them at work, how they are constantly exposed to these fumes and they use no protective gear. But after this little bit of research work and knowing about it, they've actually begun to change their practice and use aprons and gloves and masks in their profession. So, whenever there is something that is rare and obscure, I think it needs to be communicated to the scientific community. And never underestimate the utility of a case report. They may not be just simple anecdotes. Many times they can serve as instructive examples where fellow physicians can have a broader understanding, and this might enhance patient care. Similarly, we had another well-informed engineer, this time with a vanishing bone disease of the thoracic cage. We've also had another lady with a bisphosphonate refractory fibrous dysplasia in whom we've had to use denosumab. So sometimes these were both managed solely based on anecdotal experience because there was insufficient evidence. Moving on, how do we actually get on with research? What do we research on? Now, all of us in our broad specialties may have some small focused area of interest, and I think that should be built upon. And how do we get those ideas? This is an there is no sure method for it. It is largely intuitive. Sometimes when you repeatedly see your patients, you might observe some kind of patterns and trends that can be capitalized on. For example, this was a casual conversation that we had with one of our colleagues from the physical medicine department who said that they have several men with traumatic paraplegia. Yes, well, what about them? So she said that many of them sustain fractures of the femur when undergoing physiotherapy, which got us to think, why don't we look at their bone health? And sure enough, we found that the BMD at the femoral neck as well as the TBS was significantly lower in these individuals as compared to matched controls. And how does it help? As part of routine clinical care, now their bone health is being assessed. Sometimes it might be on a casual conversation, this one actually in a flight, where someone remarked that many women with osteoporosis also have missing teeth. And when we looked into this, we found that when they had more than 3 teeth that were missing, the odds of osteoporosis was actually higher. And therefore, does dentition serve as a clinical surrogate for bone loss? This was sometimes you get ideas just by listening to your patients. Many women complain that they don't sleep well. Maybe they have pain due to vertebral fractures. We don't know. We know that many times insomnia is associated with adverse cardiometabolic outcomes. But is there a link between sleep and bone loss? And that is why we undertook this prospective study, which showed that women with insomnia actually had greater declines in BMD and greater increases in bone resorption as compared to women without insomnia. So now that we have gotten our research idea and formulated our question, how do we collect data? Now, one of the boons of the last 2 decades has been the increasing use of electronic media and digitalization, and this has been a paradigm shift in data collection as well. We are transitioning from paper to electronic data collection, the advantages being a 24/7 access to collected data, lower errors, and improved document management. And strangely, there is also an RCT in this regard, which has actually concluded that electronic data collection improves time efficiency as compared to paper collection. I don't endorse any particular software, but EpiInfo is probably one that is available for free, is easy to use, and does some basic statistics as well. Now, some of the other tools that really help us at our center are the clinical workstation. This is an excellent repository of patient information that we have. This is our electronic medical record form. As you can see, there is an option called configure templates, wherein I can make a template for any clinical case that I want. So any patient who goes to anyone will have all his clinical data entered. I can also label a patient as having a particular disease. This one is parathyroid. So later, if I wish to do a study, I can go back and see all the patients that I have labeled as having a parathyroid disease. I can also have access to the list of my IP admissions. This document can be exported to Excel, from which I can search out the diagnosis of my interest. So I would suggest for those of us in non-academic institutions or private practice, if we have some kind of software like this, this will really help in daily research. Like I said, research involves teamwork. This is the entire list of staff that we have. We utilize the services of our social workers, some of our technicians, and research officers who help us with field work, with data collection as well as data entry. Another option would be to have WhatsApp groups, especially when we do collaborative research. This is my PG's thesis that she is doing with radiotherapy. So whenever a patient comes and we are caught up with other clinical work, some of our social workers in the group will make sure that the patient is in the study workflow. Now, how do we go about data analysis and statistics? There are several softwares available. Many of them are paid. And finally would be the manuscript writing, which I am not going into. There are different kinds of studies that can be undertaken, from case studies to randomized control trials. The evidence is stronger as we move towards the left, and the highest level of evidence would be a meta-analysis on which we've had an excellent duologue. Let's come to ethics. Every research proposal would need to be approved by the Institutional Review Board. And if you want to undertake a prospective study or a clinical trial, then you need to be certified in good clinical practice. And if we are private practitioners, in order to undertake a research work, you need to be associated with the nearest IRB if that's possible. Coming to collaboration, over the last almost 10 years, we've collaborated with several departments, like this one with hepatology, where we've looked at bone health in cirrhosis, hematology. We've collaborated with cardiology, endocrine surgery, neurology, among many others. Some of the advantages with collaboration is that it fosters better understanding of the same problem. There is a sharing of both experience and expertise, and it also forms a framework for individuals to divide tasks. Coming to translation into clinical practice, ultimately that's what we are aiming for. So my personal research work in my thesis included endocrine dysfunction among recipients of allogenic stem cell transplant. We also looked at their bone health. And given the morbidity that we found in this study, we have a dedicated transplant endocrinology clinic where patients who have undergone or are scheduled for transplants are seen with special care. We also have a clinic that is dedicated to osteoporosis and metabolic bone disease. Some of the other research work that has really transformed clinical practice, and it is only right that we pay tribute to them, are the work of Dr. Bavaskar and his wife in the management of scorpion stings. Dr. Dilip Mahalanobis, who discovered ORS, which is India's gift to the world, and among women, Professor Tu Yuyu and her work with artemisinin in malaria, and also Professor Gagandeep Kang from Vellore. She's known as the godmother of vaccines in India. So all of these were small steps by man, but indeed they were giant leaps for mankind. So to conclude, research is exciting. It all begins with asking questions, keeping one's eyes and ears open. Never underestimate the utility of a case report. Research requires an IRB approval. The paradigm of data collection has changed. It is good to collaborate, and ultimately the small little work that we do should translate into clinical practice. Thank you.